Okay, hey everybody. Here is your lesson for today on matching the leads to the heart region. So we had learned last week or so that the different way the leads are going on the chest. Those six at the beginning, the lead one, two, three, the Roman numerals one, two, three, and AVR, AVL, and AVF. Remember, those were augmented leads. They had the A in front of it. Augmented means that there's more than one lead involved in the direction. So we're going to match these directly to our EKGs that we've been using, practicing on. So here's where we go. Let's get started. Okay, so this is what the heart looks like in your notes. I have your note sheets in front of me, the same one you're going to be using. I have it right in front of me. So that picture up there is of the heart, and if you take a look at it, there's some different areas of the heart that are labeled. So anything that runs across the heart here would be considered lateral. Across the top is lateral. Now, what we're looking for, or what we're looking at to do, is kind of group different parts of the heart or regions of the heart with the different sections of the EKG. So if I see something that's wrong in the lateral region of the heart, which happens to be leads 1 and AVL, I would know that there's something wrong in this region of the heart. Anterior, of course, means the front of the heart. So this is all at the front of the heart right here. So all of you can think of your stickers that go here, right? V1, 2, 3, and 4. Those are clearly going to be anterior region. So that means it's picking up exactly where we placed it. And if there was a problem and like a blockage in the blood vessel, like right around here, then it would show up in one of those leads that coincide with the anterior region of the heart. We also have the inferior, which is down below. Okay. This does not include the apical area, though. The apical area is the one that's kind of at the apex, kind of down in the armpit. So you think of the two stickers we put in the armpit, that's B5 and 6. Okay. So as we go through, we're going to go through each of the leads, those six, the beginning, and we'll figure out exactly what regions of the heart are affected, go through those first six, and then we'll go through V1 through 6 as well. So go all leads, all 12 leads are going to be talked about today. Okay, so lead one, as we knew that lead one goes from our right shoulder to our left arm, right? It goes from that way to that way. That's the direction it is. So in lead one, it is the right arm talking to the left arm, okay? Just like I have this arrow here. So because this goes directly across the top of the heart, that's considered lateral. So this is a lateral region. If I see a change in lead one, it's telling me, like if I see, you don't know the changes yet, but if I see something that doesn't look right in lead one, I know that it's somewhere located in the lateral region of the heart. Okay. All right. So the next one is lead two. So, lead two goes from the right arm to the left leg. Okay. It looks like it's pointing at apical. It's not. Okay. It's pointing to the inferior region. It's just the way this heart is situated. It's not a 3D picture, so it's hard to do. So this is supposed to be going right to the inferior region. So lead two, because it goes to the foot, that's an easy way to remember it because it's going to the left foot. That's well below the heart, right? So that's going to be the inferior region. And then our last one in that first row of leads, 1, 2, and 3, to finalizes our Egan-Thomas triangle, right? That's lead three, which goes from the left arm to the left leg. So again, it's going to the left leg. Both of these go to the left leg, 2 and 3. So they're both considered inferior because it happens way below the heart. So it's noticing if there's anything happening in these blood vessels down here. Maybe there's a blockage. Maybe there's could be a blockage in the blood vessel. It could be a blockage in electrical conduction. If it's happening down in this region, it's going to show up in leads 2 and 3. Okay. I'm on delay a little bit here. Let's see if I come back. Okay. All right. I think I'm back. I think my internet connection is a little weird. Okay. Let's see if I can go further. All right. So put this in your chart. You have your little chart there that says lead 1, 2, and 3. That lead 1 refers to the lateral region of the heart. And the reason is because it goes literally right across the top. It's reading from one arm to the next. Lead 2 and lead 3 read inferior regions of the heart, below the heart. So like down below, anything that's happening at the bottom of the heart, because they both end up or head to the left foot. Okay, that is why it's that way. All right, so write those down on your worksheet. All right, let's keep going. So the next one is we're going to discuss AVR, AVL, and AVF. Okay, so all of these end up at either the right arm, the left arm, or the left leg. And again, wherever that's going, it's going to tell us what region we're talking about. All right, so the first one is our AVL, landing at the left arm. Remember the other one, lead one, landed at the left arm as well. So that's going to be lateral. So AVL stands for left arm, but also lateral. Just kind of put that in your brain. Okay, it's kind of one of those things you can cheat about. All right. Next one we're going to do is AVF. We'll go to these, get to these here. So AVF goes to the foot, right? Remember AVF went to the foot? So since AVF goes to the foot, that left foot, it's also inferior. So we have three that end up inferiorly. We have leads 2, lead 3, and AVF all land at that left foot. That means it's going to the inferior region of the heart. And then we have the weird one. We have AVL. And some of you may have, I'm sorry, AVR. Some of you may have noticed or recognized that in AVR, when you look at the EKG itself, the QRS is upside down. It's in that negative deflection area. And that's because we're literally headed away from the heart. If it's going to the right arm, it's going up away from the heart. My heart's over here. So it doesn't pick up any specific region of the heart. We don't use that for determining like what area of the heart, okay? That's just one of those things that kind of helps us remember if we've got our leads on correctly. Yeah. Okay, so write those down on your chart. AVL is lateral and AVF is inferior. And we're going to group these all together at the end, okay? You obviously can pause at any time during my notes if you want, and rewind if you want to go back. If you've got something, didn't want to hear it again or whatever, obviously just go ahead and repeat it, okay? All right, so let's talk about V1 and V2, okay? They are located obviously in the anterior region of the heart, literally right on the front, okay? And technically, if we look at our heart here, all this section here is all my left ventricle right here. And the right ventricle is smaller, it's over here. So these two, if I think of my septum running kind of like right here, these two are located on the anterior region of the heart on the front, a little bit to the right of the septum. That's what right septal stands for, right septal. Okay. Then when we talk about the 3 and 4, right, we're still on the anterior region of the heart. We're still at the front. We're just a little bit lower and to the left of the septum. Okay, so that's why it's called anterior left septal. So if we think of the septum running right down through here, we have V1 and 2 on the right side of the septum, V3 and 4 on the left side of the septum, all anteriorly placed. So all of them recognized things are going on in the anterior region of the heart. We have some very major blood vessels that come down the anterior region of the heart. So these are going to pick up those anterior blood vessels, coronary arteries that come down there. Okay. And then we have our last two. We have V5 and V6, and I talked about those already. They kind of go right down in the armpit, right? We put our stickers here in the armpit. So it's picking up the apex, the very point of the heart that's down in our armpit. And that makes sense because the stickers are exactly placed where the apex is. Okay. Again, if you need to pause and do this again, go ahead, or just pause it for a moment while you write down all that information. That's going to go in your number 3 box down there, down here on your note sheet. Okay. We'll do a little recap here. I'm flipping my page, which is what you should do. So I kind of came up with some like little cheats for regions of the heart to help you remember which regions go together. So we're going to group them together. So 1 and AVL are both lateral, and this is on your second page. You're just going to fill in that first part, not the cheat part, but the first part. We'll come back. The next slide tells you the cheats. They're not cheats. It's just an easy way to remember stuff. So 1 and AVL, both, since they both go across here, right? 1 goes across here, AVL lands at the left arm. That is the lateral region across the top of the heart. 2, 3, and AVF, since they all landed on the left foot, 2 went this way, 3 went this way, and AVF went that way, all at the left foot. Those are inferior regions. So anything that's happening inferiorly, those leads would pick it up. The 1 and 2 and 3 and 4, even though they are right septal and left septal, they are all anterior regions. So they all pick up the very front of the heart. So you can group those all together into one. V1 through 4 are anterior. You get more specific by right and left septal, but they are technically all in the same region. Okay. V5 and 6 are that apical or low lateral. They occasionally call it low lateral on the certification exam, so I want to make sure you know the difference or know that that's the same thing as apical. And that is way down in here, 5 and 6, because it's literally in our armpit, and that's where our apex is located. Okay, so it's exactly where it's placed. So again, if you need to pause for a moment to write these down, go ahead and pause. I'm going to move on to the next slide. So here's my cute little cheats. They're not really cheats. It's just like ways to remember it. So 1 in AVL are lateral regions. So L in AVL stands for lateral, or also left arm. Way easy to remember. And if you just remember that those two go together, that's an easy way to remember also. 2, 3 in AVF. F in AVF is foot, which is our inferior or below. And then if you remember that 2 and 3 also land at the foot, that's inferior or below because our feet are below our body. Okay. V1 and 2 are located on the front right, and 3 and 4 are located on the left front. And then V5 and 6 are literally in the armpit, like I said, where the apex is located. So these are your ways to remember them and how they get grouped together. So when you think about it, if you have your packet of EKGs with you, I did not bring it home with me. That was a silly me. You have the packet of EKGs with you, those practice packets with the said A, B, C, D, that one. I would circle 1 in AVL kind of as they go together. So they're kind of diagonal of each other, but we'll circle them that that's one region. And then you have your 2, 3 in AVF. It kind of looks like an L shape. You circle those 3 together, then those 3 go together, okay, on your EKG itself. And then V1 through 4 go together, and 5 and 6 go together. Those are a little easier to remember, but just in case. And again, you can pause here if you need to finish writing your notes, and you can go back and listen to me again if you didn't quite get it the first time. All right, so I'm going to talk about types of artifact and how to correct those. Okay, so artifacts, you can see this EKG. We want our EKGs to be nice and flat on the isoelectric line, right? We want that 0 on the isoelectric line to be nice and flat, so we can read all the different stuff. The P, Q, R, S, T. Make sure it's all in the right intervals, and the P to R interval and all that stuff is correct. So if it's wonky like this, we can't really tell. So we want to know what first number one, what artifact is called and why it's called that, and then how to correct it. You guys are going to be working on your EKGs with Miss Slama and or by yourself, so you need to know all the tips and tricks that you can use to fix them, okay? Because I'm not going to be there for a couple weeks. Okay, so artifact, it just means artificial, so it's not coming from the heart. So something is causing it to look kind of funky, okay? So it's not that nice straight across, and you don't see the perfect PQRST. So it's usually caused by a couple different things. Once you have them hooked up, it's super duper common. I would suggest when you're doing your EKGs live that you hook up the patient first and then turn the machine on, because it allows the machine to kind of settle in while you're putting their information in. So their name and all that stuff, their date of birth and all that, while you're putting it in, it's allowing the EKG to just kind of settle itself in. Some settling in is one of the causes of it getting artifacts. So we'll get to that in a second here. They can mimic other things like arrhythmias and AFib and things like that. So if you're not careful, you have to make sure that it's the difference between that and the just being artifact. Okay. All right. So this one's called muscular artifact. This is the first kind. Okay. So muscular artifact is caused by someone moving. It's a muscular tremor, or it's called noise sometimes. This literally can be if you have them on their wrist and they move their hand or they move their fingers, or they, make a fist or stretch their fingers. You have it on their ankles and they flex their toes. It's going to cause this. Okay. It's literally movement of the muscle where the sticker is attached. Okay, so muscle tremors, EKG show love, and this is the one that can look kind of like AFib. So I know you don't know necessarily what exactly AFib is, but it can mimic what's called AFib, which we'll learn in a future unit. So you need to know how to fix it if you see it. It's usually caused by, again, the person just can't relax. If you see this and it won't go away and you have the stickers on their wrists and ankles, move them. You're going to move them to the modified position. So you'd move them off the wrist, probably up to the shoulders, and off the ankles up to the abdomen. Okay, that usually gets rid of the artifact. 9 times out of 10 will get rid of the artifact. Okay, this one's called AC interference. You can see it looks kind of like a caterpillar down here, very fuzzy. It's very hard to see the PQRST for this, okay? So the doctors will definitely make you do it over again. So this stands for AC or alternating current. So it's like when you get electricity from the wall. So any type of electrical device that might be in the way, like your cell phone. So if you guys had your EKGs taken by the last class and they asked you if you have your cell phone on you, this is why, because it can cause artifact, okay? It really only causes artifact if it's buzzing or if you're getting notifications or if someone calls you. It's sitting idle, it's probably not going to do anything. But most of you with your Instagrams and TikToks and all that stuff, the phones buzz all the time. So you definitely probably want to make sure they're away from the EKG machine and stuff while you're doing the EKG. Okay. It's also called 60 hertz. And I just tell you both of those because they go interchangeably on the certification exam. So you need to know they both be the same thing. AC alternating and 60 hertz are the same thing. So sometimes, if it's not the cell phone, obviously, then sometimes your wires are so crossed and tangled that it causes this artifacty looking thing. So one of the main reasons we need to make sure that our wires are not crossed over and tangled mess before you start. Okay, so you don't get this type of artifact. If it's like at the hospital, if they have a breathing machine, a some of them, the blood pressure cuff goes off and the sticker's close to the blood pressure cuff. If they have those booties they put on their legs to inflate and it keeps the circulation going. So that's some of the things. If the machine goes off and buzzes and makes a vibration, it's going to cause this as well. So you just make sure nothing's there. At school, it's going to be a cell phone or it's going to be the wires are just so tangled. You have to untangle the mess before you start. Okay. And the last type of artifact is called wandering baseline. So this wandering baseline is, you can see it's not straight across. It does this sort of thing. It's mimicking the breath patterns is what it's doing. So it's not straight across. The isoelectric line is wonky. Yeah. And it's mimicking the breath patterns. Every time it goes up, that person's breathing in. Every time it goes down, the person's breathing out. So normally, it can also happen if the EKG is just settling in. So if you just hooked them up like 3 seconds ago, it might look like this, but you got to let it kind of calm itself down and do its thing. But most of the time, it's caused because the stickers are placed too close to the diaphragm. And I know we talked about that in sticker placement. So make sure you're on the fifth intercostal space and not down lower by the rib cage. That lower part of the rib cage is where your diaphragm is. And if it's there close to the diaphragm, it will mimic the breath patterns, especially if they're short of breath. If for any reason you have a patient that's short of breath, excuse me, and you have it close to that diaphragm, you're going to see this all over the place and it's hard to do anything. Yeah. So just make sure they're off the diaphragm. And then if for some reason you had to move the stickers off the ankles and you moved them up to the abdomen, again, keep them away from the diaphragm. Okay. All right, so how do we correct them? So first, you got to check the leads. Make sure they're in the right spot. Make sure the wires aren't all crossed. Make sure your sticker is laying flat. If you take the clip that's attached to the sticker and you kind of twist it a little bit, sometimes it will help it lay flat for you if you can't get the sticker to lay flat. Obviously, clear the area of any wires, extra wires, or cell phones. Make sure your patient is lying still. If you are the patient for one of your friends, please be compliant and try to hold still so you can get a good EKG. You're just holding everybody up if you're acting a fool. Okay, so just lay nice and still. Take a nice cleansing breath and relax your whole body, arms and legs, everything included, and just head back to it. It's really important the head's back so that you can lay nice and still and you won't get any artifact from that. Avoid contact with the diaphragm. I said that several times. If it fails, then you need to most likely move the lead stickers, the limb leads. Okay, move them, and then you may have to replace the sticker sometimes if the sticker for whatever reason is just not working. Like say V3 just keeps acting wonky. You've placed it on there flat, you've readjusted it, you've done all kinds of things. Just get a brand new sticker and try a new sticker. Sometimes that sticker is just faulty. Okay. The very last thing would be to replace the clip. So on your EKG machines with the little clippy things, they're plastic and they have like a little colored clip on them. They actually come off. So if that plastic thing is not clipping well, or the plastic thing breaks off and the clips doesn't work at all, you can literally just pull that piece off, and there's extra ones in the little buckets underneath the on the EKG carts. Okay, in that little bucket, there's everything you need. Okay. All right, so let's practice. Let's see. Can you find the artifact for here? I'll give you like 10 seconds. I bet you can. Pretty easy. It stands out like a sore thumb, right? Yeah, it's all this down here and this and this. So do you remember what type of artifact this is? It's not muscular. It's not wandering baseline. So this is the AC interference or the 60 hertz. So this means it's something electrical. And you can tell that because it looks like radio waves, even like just vibrations. It looks like a vibration, right? And I said what leads are affected. You can see it's lead 2 and 3. So 2, 3, and AVF actually. All the inferior leads. So those are these Eatham's triangle basically. This arm. So the wires are all tangled in there. The lead wires are all tangled. The arm lead wires are all tangled. So probably. Or there's like a blood pressure cuff going off nearby or something like that. Okay. Check for the area where the stickers are. You may have to move the stickers if you have to, or you move the device that's causing this artifact. All right, this type. Let's see, take a look at that one. Now you can see the difference. Have to think of what the name of that is. Okay, so this is nice and straight across until we get over here. It's wonky, really wonky here, really wonky here, wonky, wonky, right? So if you said wandering baseline, you are correct. And you can see V5 and 6 are definitely wonky. I think they have these down too low. They should be in the apex and they're down low. They're actually probably sitting on the diaphragm. Okay. Same with these leads here. Maybe they moved them. Again, these are the limb leads. They probably move these off the legs up to the abdomen and it's just a little too close to the diaphragm. So you can correct this pretty easily just by moving it away from the diaphragm as far away as you can. All right, this one. What type of artifact is this? Can see it's actually almost in a lot of the leads, but it's really mostly in the limb leads. Have you guys seen the pattern that happens that most of the time it's the limb leads that has this artifact? Okay. And these are the limb leads. Yeah, it's all 3 limb leads. This is muscular artifact. So this person either can't sit still, they don't realize that they're flexing their muscle, or sometimes they're just nervous. They have a little nervous little shiver or shake to them. So this one I would just literally move off the arms and legs, move it to underneath the shoulder here and down to the abdomen, and just try to get rid of any of that artifact that you can. Okay, last one. What the heck's going on here? This looks crazy. One lead is absolutely fine all the way across here. Broom, right across there, no problem. This right here, it looks like a combo of a lot of things, right? Does it kind of look like it looks a little bit like wandering baseline, but it also looks a little bit like muscle artifact. Like, what the heck is this? So this is actually what it looks like when the sticker isn't laying flat. Okay, so it just kind of like the sticker's like up on its side or twisted. It kind of looks like this. It doesn't know what it's supposed to look like. So it just kind of picks up something here and there and it makes it look really funky. Okay. So I would say it's probably the sticker isn't laying flat. It is again, we're at lead 1, 2, and 3 here. So those ones, if they're acting that way, it's the limb leads once again, and you'll have to probably just move it off the wrists and ankles, move it up to the torso area, shoulders, and abdomen, and then make sure they're laying flat. Okay. And it looks like that's our last one. Holy moly. Okay, that's really awesome. So I think this is our last one. Again, if you didn't get any of this or you want to review it, go back and rewatch it again, rewind to the parts that you needed to do. And if you have any questions, just send me a message. So I will talk with you soon. See you later.